In early adulthood, many people go through job transitions. Between the ages of 18 and 50, people have about a dozen jobs. And there's a potential then for people not to be covered in health insurance between those jobs. If you have a chronic condition, especially one that requires a lot of medical care, then you might begin to have some problems in those gaps between the coverage. We found that patients with type 1 diabetes often had a gap in insurance, 1 in 4 patients, over an average of about 3 years of coverage. And after a gap in insurance, the long-term average for the blood glucose levels were significantly higher. And this means that their glucose levels were more out of control, and it increases the risk of getting complications down the line. We found that people with type 1 diabetes had a 5-fold increase in hospitalizations and emergency room visits after they had a gap in health insurance than prior to that gap. This was an enormous increase in hospitalizations and has some serious implications for their well-being. Type 1 diabetes is very costly. You really need the medical supplies right away. If a person with type 1 diabetes does not have insulin, even for 24 hours, they will notice it. Within about a week, for sure, they would have likely died. Historically, younger adults have gotten their health care through their employment. That percentage is going down. The Affordable Care Act provided additional opportunities to get insurance. And if you are low income, there are different opportunities where you can get Medicaid coverage. But often there's waiting period, and people with type 1 diabetes can't wait. They need insulin right away. So we have to develop the systems so that people who have these chronic conditions in early adulthood are covered in some way or are able to obtain coverage in some way.